Welcome to Jewish Rubin Talk About Midlife. Hi, I'm Devora Krasnianski, and I've been coaching women for a long time in all areas of life, and more recently in midlife. Midlife is an exciting time, but it's also sometimes confusing, and so I invite experts to come here to my podcast to talk about different aspects of midlife. You can join in our conversation on our Facebook group, Jewish Women Talk About Midlife. Today, we'll be talking about when menopause messes with intimacy. This topic comes up a lot in our conversations, and so I invited Lizzie Rubin, a registered nurse, a college teacher, a couples and sex therapist, to talk about this important topic. We did have some tech issues throughout the talk, but we tried to edit it as best as possible, but the ending did not come through. So I hope you enjoyed the topic, and I'm sorry about the ending. Good morning, or to Lizzie, you're in Israel, so good afternoon. One of the topics that come up a lot is different areas about intimacy. And I'm so grateful to you, Lizzie, for offering your time to talk about this, such an important topic, because intimacy is a big part of our lives. So as we get started into this conversation, Lizzie, can you talk about the work that you do in this area and the work that you do in general?
Okay, the work that I do in general is I'm an individual couples and sex therapist. Mostly I do work with young couples or any couples actually in areas of intimacy, but I find that it always spills over into couples issues. I also was a nurse for many years, so that's why all this about menopause is at the tip of my tongue. So also being a woman helps when you want to talk about that. Yeah.
So today's topic, we're talking about when menopause messes with intimacy. And there's a lot of questions that came, but I think we should start with what we had prepared, and then we'll bring in the questions that came in.
Okay, that's a good idea. Okay, when Devora asked me to speak about this, I thought I wanted to actually call it menopause and menopause, because I think that, men also have a big part in this, because men are actually a big part of our lives. And this is also not just our problem, but every couple has intimacy is always a couple's issue, not just one side. I jumped to this because I think that women go through a lot during menopause. They have whatever hot flashes and moodiness, but nobody ever really talks about their libido with their friends. We can give each other advice, but what do you take? Oh, these hot flashes, they're crazy. But nobody ever talks about what's happening in their intimate life because we just don't do that. And I think that this is an opportunity to do that, because there's so many people that do have issues with this, and let's bring it out. We're bringing so many things out into the open these days, thank God, Baruch Hashem. And okay, so it says when menopause messes with intimacy, I think it's kind of like a scary topic, because who wants to mess with intimacy? We worked so hard on it for so many years, and we finally get to a good place. And we don't want anything to ruin it. So I'm going to help you get some ideas about how to get through this in a much better way, in a positive way. And hopefully that's going to be the idea here. Just like people managed other transitions in their lives, like pregnancy and nursing and having lots of kids and being tired, this is just another one of those transitions that we're going to have to manage with again. I do want to say that not everybody goes through a terrible menopause. Not everybody has it. Some people sail right through it. Hopefully everybody will sail right through it, but I guess on an average, most people do have all kinds of issues that they go through, and this is one of them. And there are today all kinds of ways to help, whether you believe in natural remedies or you want to go the medical route. There's a lot of things to help women get through this stage of life. But the question is, we're talking here about intimacy, and I don't know about if pills really can help that. So what really happens, I know that Devora, you've had some talks on intimacy, on menopause, right?
Right. We had a couple talks.
Right. And I remember listening to the one by Hani Karlbach, how important and how beautiful and how important this is for the whole rest of our lives and the Kedusha. Okay, but tachlis, what really happens in the body is that the ovaries stop working and the ovaries slow down, and they're the ones that provide us with estrogen to make us look young and pretty and give us that libido that we need for intimacy. I just want to say that there's another organ in the body that's really important, and that's the brain. Because once the brain knows how nice intimacy is, it's going to want to repeat those feelings. The brain is, loves to give us dopamines and happy hormones and cuddle hormones when it comes to intimacy. And we need this brain for the next actually 20, 30 years of our lives, maybe even Ad Me'Vestrim, really. But what happens to the women, and maybe you've said this already, is that there's vaginal dryness and intercourse is painful, or there's hot flashes or difficulty sleeping, night sweats, all kinds of lovely things that happen to us that we somehow manage to get through. And by the way, also men have a lot of things that happen to them too. They have prostate issues, erectile dysfunction, and it's not just us women who are going through menopause, it's men who are also going through menopause, and also whoever the spouse is that's having a hard time, the other spouse is also having a hard time. Because if two people really care for each other and they want to be together, how are they going to figure this out? And also the usual medical issues as people get older. We should all live and be well at Me'Vestrim in good health, but we know that there's things like heart issues and diabetes and arthritis and high blood pressure, weight loss issues, all those things. I don't have to tell anybody what they are. We all know. Sometimes we can even see a glimpse of them coming, and some of us are actually going through those things as well. And don't forget osteoporosis and pelvic floor function. That's also really important things. Osteoporosis, when you go for your mammograms, also ask for a bone scan. See, the nurse in me is coming out. And also, if you have problems with incontinence in the 40s, take care of it right away. In the 50s, take care of it, because these things do get worse. And it's much better to have a strong pelvic floor, also for reasons of intimacy, that things are much more pleasurable when you're in shape. Okay, and some of the psychological issues are moodiness and body image. And I want my libido back. What happened to my libido? If some people are feeling less interested, they're not too happy about that. If they've had a good relationship, and also men don't like not having their performance be good because it makes them feel less like men, and women need to feel like a woman. So we want to keep this in a good place. So there's 3 messages I want to give you. I'm going to give you the first 2 right away, and we're going to circle back to that and use that a lot. The first message is, if it was good for you before and it was important to you before, you will make it good in the future. It will be important enough for you to want it, because it isn't like Hashem is mean to us and he says, okay, you had 20, 30 good years. That's it. Time's up. No, he wants us to get through this next transition, the next 20, 30 years, or Ad Me'Vestrim, and to make this work also. We may not have as much estrogen, or the men may not have as much testosterone, but we do still want to keep this a big part of our lives. If it was good for you before, you'll make it good again. And now there's some people, and I think somebody even wrote in like this, what if it wasn't good for me before? So what does that mean? Well, it means that it's time to work on it, that you have many years ahead of something very, very good and beautiful to connect with your husband. And especially as we get older, we're much more dependent and needy of each other in other ways. And it's good to have a good relationship. So it's time to work on it. The second message that I have that I'd like to tell you is I heard from Rav Borstein from Machon Pua, who was, in those days, there was no such thing as intimacy coaches and marriage coaches. So this was a Madricha L'Bayit Yehudi. And he said something about intimacy that I'll never forget. He said, when it comes to intimacy, there are 3 important things: to invest, and to invest. Like location, location, location. So you always have to invest. We know this from our lives, that we always have to invest in this. Through pregnancies and nursings and being tired, we always have to invest and make sure that this is in a good place. How do we do that? We'll get to that. But I just want to get those 2 ideas to you, that if it was good for you, it will be good for you. If you invest in it, then you can see the fruits of your labor. And also, when we have a relationship that one side is interested and the other side is not interested, we have a problem. We have a couples issue. We've got to work on it together. Sometimes people just want to give up. I'm talking about men also. Sometimes men, if they have erectile dysfunction, forget it. I'm not going there because I don't want to be disappointed again. And even though there are many solutions for men, a lot better than there are for women these days, there still are men that are giving up, and women who feel, wait a minute, I'm not ready for this. I just want to say every decade has its challenges with intimacy. 20s intimacy is you just got married and it's very exciting and everybody will do all their best to make sure that it happens, if it's in a good place. The 30s is a lot of kids, there's Hashem, there's a lot of kids and there's people are tired and working hard, and that's the challenge. Now in the 40s, it's a little bit better because women are tough in their 40s. They become very confident, they know who they are, they've dropped a lot of the issues that they've had before, and they're really interested. So those could be very good years for a woman, that her libido is high and she's very interested. But menopause starts kicking in around the end of the 40s and start of the 50s. And what we want to do is invest, invest, invest. The 3 pieces of advice. There were 2 messages so far, and now there's 3 pieces of advice. One of them is planning. Many times I think spontaneous is the way to go. But if you think about it, mikvah is planned, and you plan it for a week in advance. And you plan it and you plan it, and you finally, when you get to the mikvah, if you have a good relationship, you're happy to be there. Like you're so excited. It's planned. So we're going to take that and use that for times when a woman doesn't have her period. And if they can plan it, they can do all, they have a little bit more time, a little bit more money, they have a little bit more opportunities to be together. Sometimes the idea of thinking about it helps people get more in the mood. Then there's time to focus on touch. A couple has, when they're in their 50s, their grandchildren may come visiting them, but their children are hopefully out the door or nearly out the door, but parents can actually find more time for themselves. So I want to say something about touch, because touch is something very, very deep. Okay, it's the one sense that never leaves a person. Some people, their eyes go, their hearing goes, what'd you say? The smell goes, their taste goes, but not touch. And we know that touch is so important. And this is really the time to focus on intimate touch, because that's what keeps a couple close. In the 20s and 30s, we focused a lot on the end result. Today, in the 50s, 60s, 70s, also happy with the end result. We want people to have pleasure. We want them to have orgasm. But we also focus on taking the time to touch, because touch connects. Touch goes into your neshama. Touch is visceral. There's a lot of studies about, in a restaurant, the waitress touched one person on the shoulder, touched a male customer on the shoulder, and the other, we've heard of this, and the other one, she didn't. And the one who was touched gave a bigger tip. So there is just something about it. And the Torah, there's a reason we have harchakos. There's a reason that we, Hashem wants us to appreciate touch. And, today everybody hugs and kisses all the time. In my days, men gave a slap on the back, shook hands, and that was it. Now men hug each other. In COVID, we kind of realized how important touch was, how much we missed it. Luckily, Baruch Hashem, we're back to where we are now. And I think that we have to make sure that we're always touching our spouses in very loving and caressing ways. There's a very famous sex therapist called Emily Nagoski, and she says that women have a lot of spontaneous desire, and sometimes they don't, but what they really do have, and this is at all ages, is responsive desire. She says, a woman says to her husband, you know what, I'm really not in the mood, sweetheart, but let's just cuddle and let's see what happens. Now, it takes 20 minutes for cuddle hormone to kick in. So if a woman is in bed with her husband and she's cuddling, chances are good that she's warming up. If she still doesn't want to be together, she doesn't have to. But the body is responsive to touch. Men are responsive to seeing things mainly, and women are more responsive to touch. So using this sense is a way to get our libido up a notch. And if it happens, it happens. If it doesn't, it's still nice just to cuddle. There's a story that she gives, Emily Nagoski gives. I sort of changed the story around to fit our crowd. So let's say there's a woman who comes home from work and she has a wedding of one of her good friends. And she says, I'm not going to that wedding. I'm so tired. I just got to go to bed. I can't go. No one will even notice that I'm not there. She gets into bed and she starts feeling guilty. Okay, I'll go just for the badeken. And so she gets in the shower, she gets into her dress that she wears for weddings, and she gets herself, calls her husband and says, okay, we're going. And she goes to the bodega, and she sees her friends, and it's really nice. And she's looking at her clock. She goes, I'm so tired, I'm leaving. And then she goes to the chuppah, and she's like, okay, I'll stay for the chuppah. And it's so nice. And then she looks at the clock and says, you know what, there's nice food, and I didn't make any dinner. Okay, we'll stay for dinner. And she's sitting talking with her friends, and then, but I'm going home. Okay, soon I'm going to go home. And then the kala comes out, and everybody starts dancing, and she forgets everything, and she starts to dance, and she's just into it, and she's so glad at the end of the night that she went to the wedding. Okay, Hamei v'in Yavin, the mashal and the nimshal is pretty obvious that sometimes we're not interested. We just get in there a little bit. We become a little bit more responsive, get in there a little bit. Now, I know there's going to be people that are going to say to me, I'm not interested. I don't want to be there. I'm not interested anymore. And I'm going to say to that, well, like, okay, but there's another party here. And are we going to, can we just cuddle? I mean, nobody has to do anything. Many husbands are okay with just feeling close. Look, if months go by, there's a problem. But if weeks go by, or a few weeks, not talking about a long time, but enough time that both of them realize this is not going in the direction that we want it to go. So then they really need to invest, okay? And they need to figure out, okay. The last thing I think anybody should resort to when they get to that position of, okay, my husband is interested and I'm not, is something called pity. I call it pity sex. And pity sex is, okay, go ahead, fine. And what I don't like about that is because nobody feels good afterwards. Not the husband, not the wife. Nobody likes that. It's just not a good feeling. On the other hand, there's something called, I don't know what to call it, I made it up, emotional sex, where you really do love your husband. You really want to be there. But you just can't go all the way. You say to him, you know what, I love you, sweetheart. I'm okay with it. I'm here for you. I love you. We'll connect another time in a different way, but I'm here with you. Now, if this happens once in a while, that's okay, but for sure, not all the time. Pity sex is a no. Emotional sex, it has to come from a place of love. Really, a place of love, like I'm here for you. So for women, there are medical solutions. I really don't know any of the natural herbs. Sure there are, I'm sure there are. I think there's something called maca and yohimba, and something called horny goat weed that people say increase libido. I am not giving my hechsher on these things. I don't know, but I've heard about that. You can look them up. Maca, M-A-C-A, and yohimba, Y-O-H-I-M-B-E, and the horny goat weed, exactly what it says. For women, hormone replacement therapy gives them back some estrogen. So that might be a solution, especially if they're suffering tremendously from night sweats and hot flashes. Many people just say, I can't anymore. I just can't live like this. They don't like at the Shabbos table when their sweat is coming, dripping down their face, and their kids are fanning them, and little ones don't know what's happening to mommy. There's also vaginal estrogen that doctors can give to keep the vagina supple and comfortable. And there's also vibrators. Vibrators are it's not just for the goyim. There are many people that this helps. And if it helps, it helps. No, I don't think there's a halacha against vibrators. It's there if anybody needs it. And for some people, it helps. And also women, one of the things is prolapse and urinary incontinence. So going to pelvic floor therapy really does help women be more comfortable and also have better orgasms. Coming towards the end, I just want to say something about men. For men, there are the PDE5 inhibitors, which let me explain to you what Viagra is. So if you have to go back to your husband and tell him what it is, because if he says, no, I'm not taking any medications, let me tell you what it is. You know how arteries bring the blood and veins take them out? So there's a valve that closes so the man can stay erect. And it's a neurotransmitter. And as person gets older, they don't make enough of that neurotransmitter. So Viagra, it makes that valve close better. That's all it is. If anybody has any problems with, has had heart attacks or strokes, they have to take away from it. And please don't let a rabbi tell you to take it, get it from a doctor properly. And so because look, after all, it's a drug. I think in Israel, it is the #2 drug sold. So that's an interesting piece of information. Also for men, there's injections and there's pumps and prostheses, whatever, people do whatever they have to do to make if they really care about their intimate life, they'll do these things. But the good news is that in this time of life, I think that it's connecting on a whole different level than you connected before. There's time, there's a lot of love, there's a lot of connecting, there's sharing. And when this problem comes up, which brings me to the third message, is communicate. Some people come to me and have never talked about these things with their spouse. They go in bed, they do what they do, and they don't ever talk about it. Or they don't talk about their feelings about it. Or maybe they sometimes pretend, or maybe they if they're disappointed, they want to say because they think they're going to hurt the other person's feelings. This is not okay. We need to talk on an adult level and to be there for each other. And for you to communicate your needs, for him to communicate his needs. And then the two people can figure this out, just like they figured it out when they were younger. They had other issues. They'll figure this out too. And if they can't, there are a lot of people who have studied this and who can be of help to them. And reach out for marriage counseling. Don't wait till you're in your 50s or 60s if you're having problems in the bedroom. Go when you're young. It's so much easier to get a young couple and to turn things around and to make things better than a couple that have 20, 30 years of pain and hurt and disappointment. So much better to start, nowadays there's a lot of religious sex therapists out there, a lot of religious couples therapists out there. Why not just get that help from people? Just like you would go for your kid, if they needed something, you would go for anxiety, you would hopefully do something about it. This is another thing where humans, Hashem wants us to make this a good part of our lives so that we can last Ad Me'avesrim. So I wish everybody, this is my bracha to everybody, not that my bracha is worth much, but they should all have a wonderful, intimate relationship. Ad Me'avesrim. Okay, now for the questions.
Thanks, Lizzie. That was very helpful. Nice outline. So some questions came in, and anyone that was on now, you can also send your questions in the Q&A. But one question that came in, I guess the first question you answered, the question was, I'm not in the mood for weeks and weeks. Do I have to have sex, or what can I do to get myself in the mood? And I think you answered that, unless you have anything else you want to add specifically to that person.
So what was the answer? The answer was plan it. The answer is give yourself enough time. Do something nice for yourself. Go out, have a nice time with your husband. Sometimes I ask people, go back to your dating experiences, or when you were engaged. Tell me about that. And they talk about how they laughed and they had fun. You can go back to those feelings of being alone again and just the two of you. Will that help the mood? Responsive desire will help the mood. If you're in a good mood, you feel emotionally connected, then I do believe that touch will help.
With the idea of that is just touch, and we'll see if it goes anywhere, but it doesn't even have to go anywhere.
Yeah, it doesn't have to go anywhere. Sometimes people are just happy. Men also like to go to sleep when they're tired. Sometimes people are too tired. Sometimes people just want to hug and hold, and that makes them feel connected. That's also a big part of intimacy. My guru, Dr. David Ribner, he says this. He says, this is sex and this is intimacy. Okay.
You don't even see how wide your hands went.
All the way. That's intimacy.
On the screen.
Sex and this is intimacy. Yeah. So, okay. So what other questions?
Okay, so this other question. My periods are coming so often, less than 1 month apart. And I'm getting so frustrated. I hate this. And frankly, it's very hard. And I find that at this stage, I'm not finding much beauty in this way of life at all, the separation in the mikvah. And I do have a beautiful mikvah, so it's not the mikvah itself. It's the craziness of the schedule.
Look, I think, this is really a question for a doctor. If her periods are coming so often, maybe there's a way that she can stretch it out. I mean, there is a way to take a gestin, or in Israel, or progesterone. Can keep the period away. I think if it's for your shalom bias, there's nothing dangerous about taking progesterone. I'm not a doctor. I'm just but I know that everybody takes it. And so maybe it's worth asking the doctor, can I take progesterone for a week to push off my period so that I can have more time with my husband? I think it's legitimate to do something like that. Otherwise, it's just really hard when periods are so close together.
So what about an ablation and just like get rid of it altogether? What are your thoughts on
Ablations
that?
don't always work. They work partially. Um, it's a possibility. I'll discuss it with the gynecologist, but they don't take away the period totally. It's just there's less, maybe shorter periods instead of like lasting a long time. Maybe it can shorten it, because what it does is they take away some of the tissue, so there's not as much that can become a period.
Another question, I guess that comes to what you said before. Is it normal to bleed so much that I'm practically filling a pad in less than an hour, and then after 5-6 days it goes back to no bleeding at all?
How old is this person? And I think this is a question for a doctor. If someone is filling a pad every hour, what's their hemoglobin? I mean, that doesn't sound right. It could be that something inside is bleeding. Maybe it's a myoma, a fibroid, or something is. Sometimes they have these pockets of blood that just keep. No, but I don't know. I would
Doctor. Okay.
I would go doctor.
And then you did answer this one. Do hormone supplements bring back libido?
Listen, estrogen is the hormone for women that helps their libido. So what are hormone replacements? If that's what you're talking about, HRT, it's basically it's like a low dose birth control pill. It's got progesterone and estrogen, and it does make women go back to normal. They feel better. They're not having all the hot flashes, and they feel a little bit more. They have libido. I think it's helpful. I don't promise anything because everybody has different levels, but I think it definitely is a worthwhile thing to look into. Nowadays, doctors are saying you could take HRT for 15, 20 years, for sure 15.
Wow.
But you do have to keep getting mammograms.
Question. How do I explain to my husband what's going on without hurting his feelings? How do I start the conversation that it's not about him, that it's about me? So there's some words to include in the conversation.
Right. Well, I think that people hopefully have had conversations with their husbands like this earlier in their lives, or even anytime, and they're just not in the mood. Our husbands are also human beings, and they also understand, hopefully, and that this is not something that we are there to be there for them. They're actually halachically supposed to be there for us. They signed on the contract that they're in charge of the woman's pleasure. But that doesn't always mean that it's like that. Okay, I understand that men have their desires. I call them desires and not needs, because it's not a need. Air, water, food, drink is a need. But let's call it desires. And, if we have a good relationship, I think they understand. Not always are we in the mood. I don't even know if it has anything to do with hormones. I think just women have the right to not consent. Women have the right for consenting and not consenting, because otherwise we don't feel good about it. And I think husbands don't feel good about it either. If they have to beg or they have to make you feel bad that you're not there for them, there's something wrong with that. There's something off with that. When the husbands are saying, you're not there for me. Sorry, that's not the conversation. The conversation is, if he says something like, we haven't been together in a couple of weeks, and she could say it, I just haven't been in the mood. He could say, how can I help you get in the mood? Because I would love to be together with you. Of course, we can't put the words in his mouth, but she could say, listen, I would love to be together with you too. Maybe we could just cuddle tonight and we'll see what happens. Let's just see what happens. We'll see. Will I go to the wedding and see if I get more in the mood?
A question about when she travels to all the different grandchildren, she's not around as much, but when she comes home between the traveling, she's not always in the mood. So there's just much less than there might have been in the past. And how to explain that? It's like, just because I was away for 2 weeks with this new grandchild or whatever, doesn't mean I have to fill in these next weeks because I missed the past.
So you're saying that a husband is saying you were gone and I missed you and I want to be with you a lot because you were gone for 2 weeks.
But she's not quite in that mood.
I would say, I hear you really missed me. You really, really, you missed me, and I missed you too. And it's the same answer, and I understand that you miss me. And maybe this is a time for emotional sex. Maybe if she really feels loving and caring for him, this is a good place. If their bedroom is a nice place and a safe place and not a forced place, that's where they connect, and that's where they hug and caress and feel connected to each other. I get it that some men might feel, well, you deserted me. But 2 weeks is sort of, you have to understand, she went to see the grandchildren. But again, how can they figure this out together? What can she do? She could say, I'm really tired tonight, sweetheart. Maybe we'll try tomorrow. Let's just cuddle tonight. Or I'm here for you. I'm really tired. I'm here for you. And then she feels loving. And she doesn't do it out of a chore or out of pity, because that doesn't work. And I don't think he wants that either.
So similarly, like when we were have a nidus cycle, there were 2 weeks on, 2 weeks off. And for some people, they actually like the off. And now that there is no more mikvah, so there's always on. And so there is no off there was no off that kind of from the outside. Now it's like, actually, I have to say I want off rather than my period.
Right. There's no reason to wait 2 weeks to be together.
Right. And some women appreciated some space, and there isn't that anymore.
So there are some couples that actually try to like live a little bit like that, but it's rare. I think that this is a time to connect in a different way. It doesn't mean just because she's on all the time, or let's not say on, I don't like that. Let's say she's mutter all the time, that she has to be available all the time. I think that, whether she has to be able to say, sometimes she might be in the mood, what about those women? There are women that are very, very happy to always be on and this is exciting. And let's figure this out. I think whatever they did before, they will probably continue. If they always did it twice a week before, they might continue something similar to that, because this is what they're used to. This is what they need to connect. I don't think all of a sudden that, she's mutter all the time, that he's going to, okay, now let's be together 5 times a week because we can. Men are also people. They also have their work. They also have their things on their mind. They also have their ups and their downs. And remember, many times they're also not performing. They might even be worried about their performance. But if they're taking Viagra, they're not worrying so much. Couples have to negotiate and collaborate on this topic. What's good for you? What's good for me? Have a discussion about this. Communicate it with them. Nobody has to ever feel like, well, I'm available. Available is not right. I'm muteret. I'm mutter. I love you. I care for you. I want to be here for you. Sometimes I am, and sometimes I would. It's not great for me. That's the way it is. Does that answer the question?
That's the way it is. I think so. And again, it comes back to the communication that they had all along. And if the communication wasn't there till now, then like you said, start now. You still have 20, 30 Admei Western, like you said. So communication now. You have a long time, and if you don't want now, may not get any better just because.
Do you have a lot more questions? I have a little story to tell.
I'll go for your story.
Okay, this is I don't know how this is related, but I think it's sort of related. When I was a nurse, it's one of my favorite stories. When I was a nurse many years ago, I worked in the ENT department. We had a lot of cancer patients. And there was one very, very cute couple. They were in their 50s. And we all knew that he was going to pass away like within a month. And he was going home for Shabbos. So he says to me, can I talk to you privately? So that happens to nurses all the time. People have secrets to tell the nurses. Okay, fine. I go behind the curtain and ask him, how can I help you? He goes, I'm going home for Shabbat, and I want to know if I can go home and make love with my wife. So in those few seconds, I thought to myself, how come nobody taught me this? How come no one ever talks about this with me? How come the doctors don't say anything? They're the doctors, they're the ones that are supposed to be in charge here. And the third thing is that what he's thinking about? I mean, he's dying, and that's what he's thinking about. And I said to him, Bevadai, of course. Of course. I figured I took a chance. Like he's going home to be with his wife for the last time before he knows he's going. And it was just made such an impression on me how important this is to couples. You know what? There he is, he's dying. This is what he thinks about. Yes, that's what people think about. I think we all think about it all the time. We just don't talk about it. And when it comes to these things, of course, we're not going to tell our friends that our husbands are having erectile dysfunction or that we're not in the mood anymore. We might talk about the sweating, but it really is on people's minds. And Baruch Hashem, this topic is getting out there, and it's much more available for people to get information.
I love that story. It's really touching. Thank you so much.
Okay, bye-bye, everybody.
Bye-bye.
Okay.
Thank you for joining me in another fascinating conversation about midlife. If you'd like to reach me, Devora Krasnianski, to talk about your midlife or anything else, you can reach me at jewishmidlife@gmail.com and follow us at Jewish Midlife on Instagram and Facebook, and join us in our conversations in our Facebook group at facebook.com/group/Jewish Women Talk About Midlife.